Alberta has laid out its reopening plan. It will come in 3 stages, province-wide. It means every region will follow the same rules. How fast will it happen? Well, that depends on the actions of Albertans. Premier Jason Kenney says the more people who are vaccinated, the more things will return to normal. And that includes the world's largest outdoor rodeo.
We are truly near the end of this thing. We're leaving the darkest days of the pandemic behind and stepping into the warm light of summer. With Alberta's Open for Summer plan, a 3-stage plan, we'll see all COVID-19 health restrictions lifted in only a few weeks' time, as long as Albertans keep doing the right things for just a little while longer. That means backyard barbecues, dream weddings, family reunions, concerts, festivals, birthday parties, dinner gatherings, and yes, the Calgary Stampede will be back on. Our 3-stage plan is based on the percentage of Albertans who protect themselves and others by getting vaccinated. For the first 2 steps, the number of hospitalizations will also be taken into account just to make sure that we're protecting the healthcare system, which has been our central goal from the start. We're taking a province-wide approach. The rules will be the same for all regions, just as COVID-19 has been a reality in all regions.
All right, if half of Albertans are vaccinated by June the 2nd, restrictions will begin to ease. Kenney says if the province stays fully on track with vaccines and low hospitalization rates, the province can fully open by July. Dr. Gabriel Fabro joins me now. He's an assistant professor of internal medicine at the O'Brien Institute for Public Health at the University of Calgary. He was also instrumental in setting up vaccine clinics at meatpacking plants in Alberta. Dr. Fabro, welcome to the Rundown.
Thank you.
So we saw yesterday that BC announced it was opening stage 1 and went to stage 1 immediately. Today, Alberta is planning on starting its reopening in June. What exactly is the criteria for choosing a date to reopen?
Thanks. So I think the Premier did a good job of explaining the dates and how they correlate with vaccination uptake, based on the bookings that are currently that have currently been made in Alberta. And so I think that's how the dates were chosen, by looking at, based on the criteria that they laid out, 50, 60, 70%. So that 50% number, and this is based on what I heard, would come from the bookings, the current vaccination rate, and then bookings into this week.
Right. So what is it about that 50%, that 60% mark that says, okay, you can eat in a restaurant or eat outside at a patio?
Again, I think I'll start with what I really liked. I really liked the message around, collective action in Alberta, so that people have a feeling of control by getting vaccinated. Our future is in our hands, so to speak. I really like that messaging. I think honestly the 50%, 60%, those are, I think, numbers that are easy as targets. The 70% number, I do worry a little bit about it, because from what my read of the literature and the research before the variants became dominant, was that we needed it was estimated that we needed about a 65, maybe even higher, 75% coverage for herd immunity to be achieved for the wild type strains. We know that the variants of concern that are more transmissible, the calculation for herd immunity would tell you that you probably need more coverage than that. So, I think it's great that it gave people a number to achieve. I think those numbers are tied to what we can do. I think those are great overall. I think the ultimate goal of herd immunity should be above 70%, and so that's a small, I think, critique perhaps, or my interpretation.
Yeah, you like it overall. I was, health commentator Andre Picard in the Globe and Mail was saying some of these reopening plans, Quebec and Ontario, are missing a crucial element, and that is when to shut down again. Yes. What is the best signs for telling us when to pull out of reopening and shut it back down?
Yeah, so while I started with what I liked, I'm also a healthcare provider and, work on COVID units. And I can tell you, talking to my colleagues just this week, it is still very, very busy. So, my gut reaction was worry that here we go again. If we open, this sounds fast. And if it happens too fast again, are we just, are we going to be in the situation where we're shutting down again and our hospitals are full again? So that's my gut reaction. I worry about that. I think what I would like to see is, and what I heard was, they're going to, as a safety mechanism, monitor hospitalization numbers. I think that's a good idea, but I would probably advocate for looking at the transmission rates. We know that hospitalizations lag 2 weeks, more or less, behind new infections. And so I think, one of the criticisms that can be made for the big provinces in Canada in this third wave, maybe save Quebec, is that we were late to respond as we saw those numbers rising because of the shape of exponential growth. So for me, one other small possible improvement for safety that would be nice to see is if we saw that transmission rate increasing, that would be a sign that, things are not going well. And would be a sign before we wait for hospitalizations.
Yeah, it's interesting. I think if I understand you correctly, so it's not so much if cases rise, it's if the cases are so bad that people are getting that it's putting them in the hospital or the ICU system.
Well, it's twofold. So once you see the cases, once we see cases rise, we know about 4% of those cases will probably develop severe disease and require hospitalization. So, if we see the cases rise, the problem with exponential growth is that it looks like this for a long time and then it turns the corner. And so I think if we start to see those cases rise, I think that would be an early sign that perhaps we don't have the vaccination coverage that we need, and perhaps we're opening a little bit quickly. I think the other piece that is really important to say, and things that I've been working on with my colleagues for weeks, if I may, is that COVID is unequally distributed, and as is the vaccination rollout itself. And so currently today in Alberta, our hardest hit communities still have the highest rates of COVID and the highest risk for COVID. They still have the lowest rates of vaccination. And so while I see these overall targets, 50, 60, 70%, and if we open, let's say we hit a 50% target overall or 60% target overall, and we open, and then our most vulnerable communities are still at 35. I just looked at these numbers. They'll be at 41, 42% as today in East and Northeast Calgary. Those communities are going to be at much higher risk for, a small or regional cluster outbreaks in those communities, and they have been very hard hit. So what I would also like to see, and I would advocate strongly for, is, I like the overall targets. I think that's easy for people to understand. It gives people agency. It gives people a sense that we have control. But I think that needs to go along with improving the vaccine accessibility to those hardest hit communities. And I think we really need to work on that still in Alberta.
All right. Dr. Gabriel Fabro, thank you very much.
My pleasure. Thank you.
Dr. Fabro is an assistant professor of internal medicine at the O'Brien Institute for Public Health at the University of Calgary. The CBC's Aaron Collins joins me now with more from Calgary on the government's plan. Aaron.
Hey, Carol. So, things are going to start moving pretty quickly here in Alberta as we begin to open up. As early as Friday, we're going to see the restrictions lifting a little bit, easing a little bit on how many people can be in places of worship. So that's going to take effect throughout the weekend. And then beginning Monday, things are going to start to slowly ease up. So that's when stage 1 fully kicks in. You're going to see patios reopen. You're going to see some outdoor sports for children happen. Outdoor gatherings are allowed to go to 10 people. So that's when we hit that magic marker of 50%, which actually happened 2 weeks ago. Then we move towards stage 2, which the province believes can happen as little as 2 weeks from now. And that's when a lot of things Albertans haven't seen in a long time, things like movie theaters and museums and these types of things can begin to open up. And the province really says that's when things will start to feel like they're back to normal or getting back to normal. And then as quickly as early July, so by the stampede, we could have no public health restrictions in place for the most part across the province, which means everything from full stadiums for CFL games to stampede parades to festivals. It's all on the table. So really, Alberta laying out the possibility for a really normal summer in as little as 5 weeks. So pretty big news today.
Yeah, and you know what, Aaron? Every week feels like a year during COVID times, doesn't it?
It sure does. We're all looking forward to getting the barbers open. I know my family wants to get this beard off my face as quickly as possible.
Yeah.
So yeah, I mean, you know, every little bit of restriction that lifts is good for everyone, and it is good news. But I was listening in to the guests you just had, and there are some questions there about what happens if some of those metrics around hospitalizations go backwards or aren't met. I mean, is there a plan to reclose things or shut things down if they don't go according to plan? Still some questions there, but on sort of first blush, some real good news for people that have been cooped up for months and months and months. Lots more stuff, good news on the horizon, and lots more things that people are going to be able to do as the weather warms up and these restrictions lift.
Yeah, you and me both. Looking forward to getting a haircut. Aaron Collins in Calgary, thank you very much.